Can you all hear me? Okay, just want to check. I had a pop-up message that said something about my microphone. So just wanted to check.
Thanks, Michelle. Everyone, since we're just running a couple of minutes behind due to that other Zoom call, we still have some attendees popping into the participant area. So I want to give just a minute or two to allow everyone to pop in.
Great.
Good morning and welcome to the Tuesday, December 13th, Washington State Department of Health Media Briefing. I'm Nikki Ostergaard, your facilitator for today's event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Dr. Tao Sheng Quanget, Chief Science Officer, Michelle Roberts, Assistant Secretary of Prevention and Community Health, and Lacey M. Fehrenbach, Chief of Prevention, Safety, and Health. To begin today's briefing, we'll open with remarks from Secretary Shah.
Thank you, Nikki. Can you hear me okay?
Sounds good.
Great. As always, I want to start by thanking our media partners for joining us today. And we want to, obviously, in advance, wish you and your loved ones a happy holidays. We appreciate everything that you do. And this holiday season is also particularly challenging when you're covering so many things and also trying to keep your loved ones safe and healthy. But thank you so much for everything you do. If you recall, the last time we had a media briefing, we had asked people to take the preventive steps to get ready for respiratory season. We were concerned about this being a very potentially very challenging respiratory season. Many of our Washingtonians did just that. I want to thank all those who got their boosters, their flu shots, continue to protect themselves and those around them by staying home when they were sick, by getting tested, by wearing a mask when necessary, all the different activities to keep themselves and others around them safe and healthy. Unfortunately, despite these efforts, we continue to face considerable health challenges in our state as we move along this difficult respiratory season. During this briefing, we are going to be providing information on where things stand as a state. I'm going to give some opening remarks. I will turn it over to Dr. Quanget, who's going to provide some additional data points for what's happening in our state. And then we'll turn it to Michelle Roberts, who's going to be speaking about vaccines. Lacey Fehrenbach, as always, is available and here to answer questions. And we're going to try to do this all within the next 55 minutes and also have enough time to obviously get to your questions. First, I know we're all excited about holiday season. This is a time for all of us to find some joy with our families, and it's also an opportunity for us to get some rest and respite. Nearly half of all Americans, as we know, will travel this holiday season. We absolutely know that people are going to be traveling. We want to make sure that they're doing so safely. We want people to be enjoying the holidays. We also want to make sure they're doing so safely. In order to help protect you and those around you during the current increase in respiratory disease, we are asking people to do their part, just as we did when we previously had our briefing. A little prevention goes a long way. If you're sick, especially if you're sick, don't expose others, and please contact your healthcare provider for further direction. Department of Health continues to recommend that people wear masks in crowded or confined settings. Keeping a mask handy and using it appropriately is a great way to navigate these challenging situations, and we hope more Washingtonians will think about that. Individuals should continue to assess their own personal risk and encounters with others, especially when in public. This applies especially to those at higher risk due to underlying medical conditions. And I want people to note that risk continually changes. It is not a continued risk of the same magnitude. It changes very quickly. A setting may become quietly, all of a sudden, very crowded or poorly ventilated or populated with people who are coughing or with symptoms. That's why it's so important to continue to know what's happening in the surroundings around you. I'm sure all of us remember how throughout the COVID-19 pandemic, we saw hospitals and healthcare system overwhelmed. And now, unfortunately, we're seeing this surge yet again. Many are calling this the triple-demic of COVID, flu, RSV, because the cause is not COVID alone, as the last couple of years. Instead, it is the intersection of multiple respiratory diseases leading to an additional strain on our healthcare system's capacity. If I could ask our comms people to go ahead and pull up the slide. I want to start by showing this map of influenza. This is from the CDC across our country. And as you can see that we in Washington have a significant amount of influenza-like illness and transmission and activity that's occurring in our state. Comparing to other states, but I don't think it's fair to say that this is consistent, because it goes up and down in terms of how the activity will transition over subsequent weeks or preceding weeks. However, one constant is that we are seeing increased flu activity in our state. It is primarily influenza A, and we know this flu activity is impacting people. We have many of our own Department of Health family members who have recently had influenza or a respiratory-like illness, and we also have that across our healthcare system, across our communities. And so I think all of us know somebody who has got a cough, a sneeze, or a sniffle, and is worried about it being something that could be potentially concerning enough to be seen by a healthcare provider. So I want everybody to know this map, to see this map, but also recognize this map is going to change over time. But we are in the midst of, right now, this winter surge. This is the winter surge of influenza and respiratory season that we are seeing right now in our state, and we have to take the appropriate steps to continue to combat it. If I could show the next slide. So when we talk about influenza and influenza-like illness, we're also concerned about RSV. So respiratory syncytial virus is certainly a virus that oftentimes is impacting kids, but we're seeing that in not just kids, but also in other populations as well in our state right now. And as you can see here, what I want you to focus on is the fact that we've had this marked increase in RSV activity in the state of Washington. There has been a little bit of leveling off, which is great, and we're hopeful that continues, but we are again in the midst of this winter surge, the winter surge of flu, the winter surge of RSV, and the winter surge of respiratory disease, which is really impacting our healthcare system. And we want everybody in Washington to know about this, to take the appropriate steps to combat this alongside us, and also to help our healthcare system as well as each other to be able to be safe and healthy during this, again, respiratory and holiday season that are all coming together at the same time. You can take this slide down. We must continue to act like one connected and caring community if we're going to help alleviate the stress on our healthcare system, the stress that it's under right now. We're continuing to ask Washingtonians to do your part by staying updated on your vaccines, whether that's COVID-19 boosters, whether that's influenza, wearing a mask in crowded spaces with others, washing your hands, staying home if sick, and being tested or getting tested is so critical. We also encourage people to activate WA Verify if they haven't already on their smartphones, joining the millions who have done so far in our state. Since we've gotten a lot of these questions from many of you, let me just take this on right now. We have no plans in place currently for additional statewide mask requirements. Further, at the present, since everybody may have not been following this, given the current situation, existing requirements for masking statewide are in healthcare and correctional settings, and those continue for now. They are continually being evaluated for further modification at a later time, but given where we are in our state, we do not believe this is the time to make those modifications. There are many things that we are doing across the state of Washington at a state level. We're obviously working very closely with the governor and the governor's office and our fellow state agencies, and I cannot say enough about our continued partnership with everyone at the state level. We're continuing with our messaging to the community so we can what I call community triage effectively, and that means when and how to use the healthcare system, when to use the ability to show up in a clinic or an emergency department is not what we want people to do. We want them to use nurse triage lines, telehealth, call their doctor or their clinic, call the emergency department if you don't have a doctor or clinic and you're worried about your symptoms, but do not show up because we do not want you to potentially expose others, or you might be able to get the care through telehealth or through phone lines. We're also leading the Washington State Health and Medical Multi-Agency Coordination Group. It's called the MAC, multi-agency, the MAC group, to coordinate with healthcare associations like the Washington State Hospital Association and the Medical Association, our local health jurisdictions, tribes, and so many other partners that are on the ground as well. We're also working very closely with the Washington Medical Coordination Center to help with patient loading across our system in Western Washington, Eastern Washington, and throughout. Our teams are continuing to look at regulatory flexibility wherever it's possible without sacrificing patient safety, and we're certainly doing that through our Department of Health team as well. And finally, we're coordinating with other neighboring states and federal partners, and I just want to give a tremendous amount of kudos to our neighboring states who have continued to work so closely with us and doing everything they can for their own residents. I also want to thank our federal partners for the work that they are doing. So we're doing our part as a state, and we're asking Washingtonians to do their part. That also includes being aware of any recommendations of local health officials for their communities or their establishments. As you are aware, several local health officers released a statement last week regarding recommendations around masking. It is so important for people to be aware of these and other recommendations based on where they live. I hope people will remember that our health should be our #1 priority, given you cannot enjoy the holidays if you're simply out for the count and sick. Please take the precautions, please help our healthcare system, and please continue to be safe and healthy. I also want to segue for a moment into winter weather. We know that winter weather over the past month has changed. You know, we've seen snow, we've seen ice, we've seen freezing temperatures. There are many things that are changing in our environment, and we want to make sure people are prepared and staying safe. As you know, deaths are oftentimes higher in winter months because of the concern about how there have been changes. There are changes in behavior and the human body. Certainly cold weather can cause our blood flow to be limited because narrowing of the blood flow through our cardiovascular system, both to the heart as well as to other parts of the body, and makes it harder to work to pump that blood. So certainly if you have heart disease, please talk to your healthcare provider about the activities that are safe for you during the winter season. We oftentimes see people who are shoveling snow who wind up having heart attacks. We want to make sure that people are taking appropriately their care of themselves and those loved ones around them. Certainly as temperature drops, we also tend to spend more time indoors, making us more vulnerable to sedentary lifestyle. We want to get people to continue to be active. Even if you decide to stay indoors, it's important to keep moving, and you can do that by getting some at-home workouts in, or just simply a walk around your living room. This can also reduce anxiety and help calm the stress that's in all of our lives right now. Certainly be careful when you're on the road. We want you to dress appropriately. We want to make sure that you're protecting your pets, your livestock, and other property. Make sure they have plenty of food and water and not overly exposed to extreme cold. And certainly we want people to be prepared for any power outages. We also encourage you to check on any aging loved ones or neighbors, and also on kids during this time to ensure they're safe, they know what's happening, and they are appropriately prepared for the winter months. Certainly have a winter emergency kit for your car and even your home. And we want to make sure that you're taking care of yourselves, especially if you get stranded somewhere. For these and other tips, please go to our DOH website, www.doh.wa.gov. And I just hope that as I close here, like many of you, we are absolutely looking forward to spending time with our loved ones during this time of year. Let's be clear, though, we're not saying do not gather. What we are saying instead is take steps to be smart and prevent getting sick and getting others sick. Remember, simple steps can help all of us and can help you. In turn, it can help our healthcare system, and certainly that is also what we're concerned about. Please do what you can to help each other, help yourselves, and we hope you have a healthy and safe holiday season. With that, I'm going to turn it over to Dr. Kwan-Get Tao.
Thank you, Secretary Shaw, and good afternoon, everybody. I'd like to offer some more details about what we're seeing this respiratory virus season and how we are addressing concerning trends. And I'd like to start with the familiar respiratory virus that Dr. Shaw mentioned, and that has likely affected you, a family member, a friend, or coworker recently, and that's influenza or the flu. And if we could have the next slide, please. So influenza activity in the previous 2 years was lower than usual due to many of the measures used to slow the spread of COVID-19. However, this year, flu has hit earlier and harder than we've seen in recent years. And as Dr. Shaw mentioned, flu activity is high across the country. And as you can see in this graph of the percentage of hospital visits for influenza-like illness, this season, shown in dark green, shows a rapid rise compared to previous seasons this time of year in light blue and light green. Our most recent data shows 26 lab-confirmed flu deaths, sadly including 3 children for the 2022-2023 flu season. And this number is equal to the total number of flu deaths reported for the entire 2021-22 flu season. Most deaths have occurred in people with underlying health conditions or who were elderly, and the figure is likely an undercount because each year many flu deaths in the elderly go unreported. But it's important to remember that people of all ages can get the flu, and chronic conditions as well as not being vaccinated puts you at higher risk for severe illness. Influenza A continues to be the dominant strain, and fortunately, the current vaccine offers good protection against this strain. So getting vaccinated against the flu now is more important than ever for protecting yourself, your loved ones, and your community. By getting vaccinated, you're also helping reduce the burden on our overloaded healthcare system. You can also do your part by practicing healthy habits which can help prevent the flu. This includes washing your hands with soap and water for 20 seconds, or using hand sanitizer if soap and water aren't convenient, covering your coughs and sneezes, staying home when sick, and wearing a mask in crowded indoor settings. If you do get flu symptoms and are at high risk for complications or you're very ill, contact your healthcare provider right away to see if an antiviral drug could reduce your risk of severe disease. Flu antiviral medications are most effective if started within 48 hours of your first symptoms. To learn more about flu and flu activity in Washington, visit the DOH website, www.knockoutflu.org. Another respiratory virus that continues to impact our communities and strain our healthcare system is respiratory syncytial virus, or RSV. Typically, RSV causes common cold symptoms, including a runny nose, cough, sneezing, fever, and a decrease in appetite. These symptoms usually appear progressively in stages and not all at once. In infants and toddlers, particularly babies younger than a year old, RSV is the most common cause of bronchiolitis and viral pneumonia. In addition to cold symptoms, children can have wheezing or labored breathing, and in very young infants, common symptoms can be irritability, decreased feeding and activity, and difficulty breathing. Fortunately, the vast majority of children and adults who get RSV recover on their own without treatment. The young infants and the elderly are at higher risk of hospitalization. There is no vaccine for RSV, but a monoclonal antibody treatment can help protect some infants who are at highest risk for severe illness, including premature infants and those with underlying heart or lung disease. Okay, now if we could have that slide again, please. Our latest data show that RSV appears to be coming down from a peak in Washington state. And if we could have that graph. Great, thank you. So our latest data shows that RSV appears to be coming down from a peak in our state. And in this graph, RSV positive specimens shown in dark purple, you can see are declining, while influenza shown in light blue is still rising. And the other colors represent other respiratory viruses that we monitor. So even though RSV may have peaked, we're not out of the woods yet by any means. And as Dr. Shah said, we encourage everyone to do their part to relieve the strain on our healthcare system. Please treat symptoms at home when possible. As I mentioned, almost all children and adults recover from RSV without treatment, and testing for RSV usually is not recommended or needed. Of course, contact your medical provider if you feel you need additional care. As Dr. Shah mentioned, it's a good idea to consult a nurse or seek care by telehealth first before going to the urgent care or the emergency department. And remember, the same prevention measures work for RSV as for flu and COVID-19. Washing your hands, covering your coughs and sneezes, staying home when sick, and wearing a mask in crowded indoor settings. While influenza and RSV are at top of mind for many, we also want to remind people that COVID-19 is still very much active in our communities. And if we could have the next slide, please. The most recent data on our COVID-19 dashboard is showing a rise in overall cases across our state since the end of fall. And as you can see in this graph, we've also seen an increase in hospitalizations in recent weeks. So it's really important not to let our guard down, especially as people prepare for celebrations and prepare to travel to spend time with family and loved ones this holiday season. As more people spend more of their time indoors with the arrival of cold winter weather, we want to emphasize the importance of getting the COVID-19 vaccine and updated bivalent booster. It's important to remember that immunity gained from past vaccinations is constantly waning and may not fully protect you against the latest subvariants. So now is the time to get vaccinated if you haven't done so. And now is the time to get the updated booster so you can protect yourself and those around you. And again, as with other respiratory viruses, remember to wash your hands frequently, stay home when you're sick, and wear a mask in crowded indoor settings. I'd like to say a little bit about testing. Testing is one of the key tools we use to prevent the spread of COVID-19. And I'd like to mention a few items about home testing that might be helpful. Certainly test when you feel sick. COVID-19 has a wide variety of symptoms. So if you're not feeling well, it's good to get tested as soon as possible so that if you have COVID-19, you can isolate and also mention it to others around you that they may have been exposed. Test after you've been exposed to someone who's tested positive for COVID-19. And it's also a good idea to test before and or after traveling, or when you're going to gather with a group of people, especially if there are those who are at risk of severe disease, or maybe those who may not be up to date on their COVID-19 vaccines. Also, for children under 2 years old, parents or caregivers may now use at-home tests for COVID-19. To increase access to COVID-19 testing, the Department of Health continues to offer free at-home tests through the Say Yes to COVID test program. The Department of Health has procured an additional 3 million at-home tests to support our state through the winter respiratory virus season before we start ramping down the Say Yes to COVID test program. So to order, visit sayyescovidhometest.org, and the tests will be delivered to your home or work address free of charge. Through December 31st, each household may order up to 10 free at-home tests per month. Then starting January 1st, our Say Yes to COVID test program will begin ramping down and offer 5 tests per month per household. And a reminder that most health insurers are required to cover 8 at-home tests per member per month. Finally, as Dr. Shah mentioned about masking, I also like to talk about masks. There's been a lot of discussion around masks lately. As Dr. Shah mentioned, the Department of Health continues to recommend wearing a mask to protect yourself and others and to reduce the spread of all respiratory viral illnesses, particularly when you're in crowded indoor settings. As Dr. Shah mentioned, masking is still required per the Secretary's order in healthcare and correctional settings, and we will continue to evaluate this in the future. While there are no plans to return to a statewide mask requirement, we recommend, again, wearing a mask around others, particularly in crowded indoor settings, as one of several layers of protection from respiratory viruses. And be aware of recommendations from your local health officials for establishments in your area. The Department of Health supports the efforts of local health officials and businesses to support their communities. And so if you're in a setting where safety measures are recommended, please follow them for the protection of everyone in your community. So thank you all for doing your part, and I'll turn things back to you, Nikki.
Thank you, Dr. Quanget. And now we'll hear from Assistant Secretary of Prevention and Community Health, Michelle Roberts. Go ahead, Michelle.
Thanks, Nikki, and good afternoon, everybody. I want to share some more information about vaccines. As many of you already know, the updated COVID-19 booster dose that targets the current variants of COVID-19 that are most common in our communities. This eligibility was expanded last week to be available for children as young as 6 months old. This means that everyone aged 6 months and older is eligible to get this updated COVID booster. This expansion comes at a really crucial time, as Dr. Quanget and Dr. Shah have been explaining. Our hospital systems in Washington State are being overwhelmed with pediatric cases of many respiratory illnesses. Having updated protection against COVID-19 is an essential step towards keeping our kids out of the hospitals and our communities safe. The new COVID-19 booster expansion authorizes both Pfizer and Moderna's Omicron targeted booster to be administered to children aged 6 months and older. There are some changes that are unique to this age group, which includes no mixing and matching of brands, and also how the primary series for Pfizer is now structured. Children aged 6 months through 5 years who received the original monovalent Moderna COVID-19 vaccine are now eligible to receive an updated bivalent booster 2 months after completing the primary series. The Pfizer COVID-19 vaccine for children 6 months through 4 years will now include 2 monovalent Pfizer doses and 1 bivalent Pfizer dose. So children aged 6 months through 4 years who have not begun the 3-dose primary Pfizer series, who have not received the 3rd dose of their primary series, will now receive an updated Pfizer series with the new COVID booster. Children 6 months through 4 years who've already completed the 3-dose primary Pfizer series are the one group who's not eligible for additional booster doses at this time. Well, Washington is among the most vaccinated states in the country. We're still seeing slow uptake rates among children under age 12. This is especially concerning given the concurrent presence of COVID, RSV, and flu in our communities. We are really concerned about the lagging COVID-19 booster rates. It leaves people at risk for severe outcomes from COVID-19. As of December 10th, while nearly 80% of the total population has started gotten at least 1 dose of COVID vaccine, only about 27% of the eligible population has received any dose of the updated COVID-19 booster. And only about 18% of children aged 5 to 11 have received the updated booster. We cannot stress enough how vital it is right now to ensure the children in your life and everybody in your life have this crucial protection against serious illness, hospitalization, or death from the COVID-19 virus. So please, if you're not up to date on your COVID-19 vaccines, please schedule your appointment today. Now I want to talk a little bit about flu vaccination. As Dr. Quanget mentioned, we're experiencing high flu activity. Flu activity in the past 2 years was unusually low due to pandemic restrictions, but flu disease has returned and is increasing at an alarming rate. As flu vaccine reduces flu illnesses, hospitalizations, and deaths. It protects the person getting vaccinated and the people around them. The flu vaccine is your family's best protection against flu and is an important tool to help prevent the spread of flu and to reduce the burden on our already stressed out healthcare system. The Department of Health recommends yearly flu vaccine for everyone aged 6 months and older, including pregnant and lactating people and people at higher risk for flu-related complications because of other health conditions. Even healthy children can become seriously ill from the flu. Children aged 5 and under are at the highest risk of complications from the flu. People under age 19 can get flu vaccine at no cost, and the vaccine is covered by insurance for most adults. It takes about 2 weeks to see maximum protection from the flu vaccine. So as you're considering your holiday plans, put getting your flu shot on the list. As a reminder, it's completely safe to receive your seasonal flu shot and your COVID-19 vaccine dose at the same time. We urge everyone to stay vigilant on receiving these crucial protections. Talk with your established healthcare provider first. And you can also visit vaccines.gov and search for booster availability by zip code. You can also call the COVID-19 hotline at 1-833-829 or 1-833-VAX-HELP to speak with someone one-on-one for assistance in finding options near you, or if you need language assistance. In closing, if you've been waiting on getting your flu shot or scheduling that COVID-19 vaccine appointment, now is the time. Our hospitals are at a crucial point, and we need to do whatever possible to alleviate pressure on our already stressed out healthcare system. Many of us will be gathering with our loved ones soon or traveling during the holidays. Think of prioritizing vaccines as insurance on that time together. We all need to do our part in helping keep our communities, our families, and our loved ones safe, as well as supporting the heroes working in our healthcare systems. So please get vaccinated today if you haven't yet. I'll turn it back to Nikki.
Thank you, Assistant Secretary Roberts. This brings us to the question and answer segment of our briefing. And we do have several reporters in the queue for questions today, so we're going to try our best to get to everybody. We do have quite a bit of time left here. So to start off, we're going to go to Nicole Jennings with Cairo. Nicole, you should be able to talk. Nicole, you're still muted. Are you with us? Okay, we will come back to Nicole. Next, we're going to go to Rachel Sun with the Lewiston Tribune. Rachel, you should be able to talk.
Okay, can you hear me now?
Yes, go ahead, please.
Okay, perfect. Yeah, I was hoping that one of you could elaborate a bit on which areas in Washington seem to have been hit the hardest, either by flu or RSV or COVID or all three. I know there's mentions of some areas having specific guidelines from their health departments.
Yeah, Rachel, thank you. And Tao and Lacey, you might have some more specifics on this, but let me just give a general comment first, which is that we're seeing activity throughout our state right now. And so I think it'd be not wise for someone to think, well, the activity is higher in one part of the state than another. Because the reality is that we move around quite a bit, and you're always in interaction with people that are from other parts of the community, other parts of the state, or even other parts of the country, because people come in and out. You don't always know who's around you. And so I think it's just important for people to continue to remember the preventive and safety steps that we've been outlining here, for that reason, that we have had flu as an RSV activity, and less so COVID, but still COVID activity in our state throughout. And so I think it's better for people to be thinking about the community around them and really making sure that they're staying safe as best possible. So with that, Tao and Lacey, I don't know if you have anything you want to add.
Yeah, thanks. I would agree that these respiratory viruses are impacting the entire state. In general, a pattern that we sometimes see is that a virus will peak first in the western part of the state, and followed by a peak maybe 1 or 2 weeks later in the eastern part of the state. But still, viral infections don't follow county boundaries. And so really, this is something that we need to respond to as a state.
Yeah, and I can jump in quickly and say, similar to what Dr. Quanget shared, there is some difference across the state for COVID-19 rates. The rates are a little higher in Western Washington than Eastern Washington, though they're increasing statewide for the most part. And we expect that probably will continue given, where we are in the winter respiratory virus season and also with a lot of upcoming gatherings. So those simple steps of kindness and love that you can show your family and your community are really important, no matter where you live in the state of Washington, and for anyone out there that is coming to visit the state of Washington. So getting vaccinated for both COVID and flu, wearing a mask in crowded, confined settings, and especially if you're going to be around vulnerable people, elderly or infants, or people who are immunocompromised, and getting tested.
Thank you. Our next question comes from Amanda Zoe with Seattle Times. Amanda, go ahead.
Hi there, everyone. I had a question about the Say Yes to COVID home test program. I think officials said that it was 10 per household now and then ramping down to 5 in January. I was wondering if supplies was low earlier and, when those tests were ordered and whether they're available now.
I can jump in and take that one. And this has happened before in a surge. There was a period of time starting the weekend of Thanksgiving and early the week following where we had supply issues with COVID-19 tests. We have ameliorated those. We are shipping tests out now, so they are available. The ramp down is not necessarily a supply chain issue. It is really moving forward in our journey through the pandemic. So through the end of this year, we're continuing with 10 tests per household up through December 31st, and then starting in the new year, ramping down to 5 tests per household. And again, as Dr. Quangette mentioned, you can also purchase tests in pharmacies, and most insurers are required to cover 8 per covered member per month. So that we expect that to continue.
If I could add one thing, Lacey, to what you just said, which we haven't talked about, but if everybody remembers, our WA Forward plan was really set to go through the end of 2022. That's the way we had framed it. We continue to follow the tenets of that plan, and in fact, in the early part of 23, we are mindful that we're going to likely continue with that plan, that there's no thought in our mind to change the course. We want to, all the commitments we've made, we're going to continue to make, but we are going to continue to review the plan to think about places where it's not as appropriate or as necessary to do the same level. And this is an example in COVID testing of the same level of tests that are going to be provided from our state Say Yes to COVID test program. So just a reminder, if you go back to WA Forward, if you look at it, it does say through the end of 2022, our plan is to continue in that same course in the early part of 2023. And then obviously over time, we're going to start to really look at it more closely and think about places where we may need to modify further.
Our next question comes from Jerry Cornfield with the Everett Herald. Go ahead, Jerry.
The chart clarification I had was on the flu vaccine chart. I could not tell, but are the vaccine rates way behind the pre-pandemic levels? Could just give us a big picture percent to now versus pre-pandemic? And then a question on patient loading. Are you seeing patients now being moved from one hospital to another because hospitals are filled up? If so, where is it happening?
Yeah, Lacey and Tal, let me, we'll take that second question from Jerry next. So if you can think about that. But Michelle, if you want to start with the vaccine question about flu vaccine compared to previous years.
Yeah, great question. And we can follow out with some details on the data on that slide. And actually, it looks like the staff are putting it back up. But great question, because I didn't go into a ton of details. So I'm really glad you asked, Jerry. On this slide, there's a couple of things happening. It is talking about the number of doses that have been administered each year compared to the previous year. So the top line on each graph, that darkest blue color, is the number of doses given and reported to our state immunization information system so far this year. Overall, all those doses mean there's about over 2 million. You can see the number of doses given so far this year. And we are seeing the number of doses going up right now, week to week, which is a good sign that people are taking action based on the level of disease happening in our community. So we're glad to see that. But you can, and about 28% of people across our state have gotten vaccine so far this year. And that is slightly higher than previous years. So that's a great sign overall. But then what this chart's showing is the number of doses given by different age groups. And you can see there's some significant differences when you look at the number of doses by age and which age group, and then when you look at the periods of time. So overall, while I've said for as a whole, as a state, we're higher this year compared to previous states, but you'll see at the very bottom of this graph, most of that difference is probably coming from increased vaccination among our oldest adults, people age 65 and older. And you can see that our youngest age groups, especially kids 6 months through 4 years and age 5 to 12 years, were actually behind in vaccination uptake and the number of doses that have been given in those age groups this year compared to previous years. So we're really concerned about these gaps we're seeing in different age groups. And when you really talk about the overall statewide number, that can cover that we've got significant really disparities between different ages. We also see gaps when we look at this data by county and different areas across our state. So these are the areas that we're working on, working with healthcare providers, working with our own vaccination efforts to really increase vaccination for these groups.
Yeah, and if I could just start with the second question that you asked, and then Lacey Tao, please feel free to jump in. So again, we're working very closely with Dr. Steve Mitchell's group at WMCC out of UW Harborview that does a fantastic job of really keeping track of what's happening in all parts of Washington with respect to both surge, but also with respect for requests for transfers and also other resources that may be needed in the healthcare system. The pediatric capacity is the one that was being watched mostly, and the concern was certainly the ability for healthcare providers to have the bed capacity to be able to take care of children who might have one of the diseases that we've been referring to throughout this briefing. One of the things that's happened is that many of those hospitals or healthcare systems are able to, through an incredible amount of ingenuity, able to care for, increase some of the temporary bed capacity or the ability to take care of additional people that have been coming to their emergency departments or needing hospitalization. But there are times where it does require some transfers across the system, and that's what WMCC has been really good at. Fortunately, it has not required as much of this eastern, western, eastern piece of coordination for transfer, although it still happens. It's really been more in the region where you've got one hospital that may be transferring over to another hospital and requiring some of the coordination of how to go through that patient loading to make sure that that is happening appropriately. So it's happening throughout Washington in a regional manner, but there are times where it does have to be more from one part of the state to another, depending on what the needs are of the individual and the capacity and or ability for that healthcare system to be able to take care of the needs of that individual, especially if it's a higher level of care that's required. So that's the general comment. I hope that helps, Jerry. And then Lacey and Tao, if you want to add to that.
I can jump in with just a little bit of context. So Dr. Shaw mentioned the Washington Medical Coordination Center. They are the entity that works with all the hospitals to find beds and move patients when we need to move them. Their call volume in the month of November was the highest it's been since January during the peak of the Omicron wave in our first Omicron wave in our state. So yes, the strain on the healthcare system is real. The strain has been driven by pediatrics up until recently. There's now a lot of strain even in the adult system as well. And we're seeing that in terms of wait lists for people to be admitted. So that is what WMCC and all of our hospitals are here to coordinate on, getting those patients who are waiting to be admitted into the right level of care. And sometimes that means moving patients that are in a bed right now to another facility. So we're very, very grateful for their partnership and the incredible work of our healthcare partners, as well as our primary care system and health educators across the state who have helped reduce the burdens on our emergency departments so that we can care for the critically ill patients.
And I don't have anything to add except just to emphasize that the Washington Medical Coordination Center, they're seeing record numbers of requests in recent weeks, which is just an indicator of just how strained our healthcare system is, and which is why it's so important for people to get vaccinated against the flu, to get up to date on their COVID vaccines and get the updated booster if they haven't already, and then to practice some of the prevention measures that we talked about before, staying home when you're sick, washing your hands or sanitizing your hands frequently, covering coughs and sneezes. All of these things can help reduce the pressures on our healthcare system and are really important to do now through the holidays.
Thank you. Our next question comes from Misty Reed with KXLY. Go ahead, Misty.
Can you hear me now?
Yes, we can hear you now. Go ahead.
Thank you. Can anyone speak on what the hospital system or what the health department is doing in tandem with the drug shortage, specifically for kids that are dealing with these types of viruses?
Well, Misty, and maybe Dr. Quanget or Lacey can add into this. I would say that, the one that we're watching mostly is Tamiflu and amoxicillin, from an antibiotic standpoint. These are the ones that both statewide as well as across the country are the ones that are prime concern for shortages, because they're used to treat respiratory disease of some form during a season like we're having now. So one of the things that we're doing certainly is raising awareness of the judicious use of resources from our healthcare providers. They're very good at that, especially in times like this. So it's just a gentle reminder, but also recognizing the importance of coordination. And I think you hear that as the theme as we're talking about with WMCC or what's happening with the MACG. That I referred to earlier. It's really very much about the coordination. And so just coordinating again with our federal and other partners just to see where the shortages are and what we can do to, again, we don't have as much of a role in the shortages. It's a supply chain issue at more of a federal level or at a source level, but we do the best we can to really help support the healthcare system for especially the awareness piece of it. But Lacey, Tao, I don't know if you have anything to add.
Well, one thing I can add is that as an absolute backup, we do have the Strategic National Stockpile, which is a state and federal stockpile of oseltamivir, which is the generic name for Tamiflu, which is used against influenza. And that we have a stockpile of oseltamivir capsules. The shortage has been, well, we've heard of shortages of oseltamivir suspension for children, and although that's not in the stockpile, the capsules can be broken and the powder in the capsules sprinkled over food or chocolate syrup to make it easier to give to kiddos, and so that's so we've let our tribal and local health partners know that's available as a backup. But with the reports of shortages are very uneven. They're throughout the state, but some providers in some jurisdictions are reporting no difficulty at all obtaining oseltamivir for their patients, while others are reporting quite a bit of difficulty. So, but as a backup, we do have the stockpiles of oseltamivir that tribal and local health can call upon to supplement. Thanks.
Okay, for our next question, we actually have 3 reporters left in the queue, so we're going to go back to Nicole Jennings. Nicole, go ahead.
Hi, can you hear me?
Yes, go ahead.
Great, thanks. What specific metrics would it take to decide to implement another mask mandate? And at that point, what would that look like?
Yeah, Nicole, that's a speculative question. Again, we don't have any plans right now to put any additional mask requirements in place. What we have been reminding everybody are the recommendations that are in place. And so I think the key message from us is really that there are so many tools that we have at our disposal, but they're only as good as we utilize them. And so I think that's the most important aspect of what we're focusing on right now. Obviously, we continue to monitor what's happening in our healthcare system. We're monitoring what's happening with our capacity within the healthcare system. We're monitoring what's happening with disease transmission. It's a whole complex set of inputs that we continue to be aware of, but we have no plans in place to change any of those mask requirements at this time.
Okay, our next question comes from Graham Johnson with Cairo. Graham, you should be able to speak.
Hi, I'm wondering if you could clarify your statewide masking recommendations. Are they basically the same as they've been for a while? On your website, we see really clear recommendations for public transit, but it's a little more confusing on the recommendations for indoor settings because it references community transmission levels, which a lot of people don't know. So I'm just checking here if anything has changed. And just to follow up on Nicole's question, I just want to be clear on the mask requirement. Is the idea at this point basically completely off the table?
Well, Graham, with that, just we do not have any plans in place. We're not having discussions for putting mask requirements or anything of that nature in place at this time. And so we don't have, her question was more about metrics. Since we're not considering that at this time, we haven't looked at any of those metrics to say this is what we would be doing. But obviously, we also recognize that we're monitoring things very closely. And we've been very clear, our governor has been very clear, we're going to do everything we can, everything that's necessary to protect the lives and health of Washingtonians. We've done that throughout this pandemic. We've made some very difficult decisions that oftentimes have been criticized, and yet we've stood by those decisions to be able to protect Washingtonians. And we've done that, we'll continue to do that, but we don't have any plans in place at this point to put statewide mask requirements in place. And also just a reminder, the state of emergency that ended on October 31st, just a reminder that state of emergency end also means that, just like you saw with local health officials, I mean, there are things that local health officials and or establishments can do also in terms of putting the requirements in place for their local setting. That's what, the responsibility, that's what the opportunity is there for those local health officials. We have continued to support that throughout the pandemic. We certainly continue to support that now. I will say that the mask requirements discussion is one that oftentimes gets into a whole host of considerations, but I would say that the recommendations have not changed, especially when you're in confined and crowded settings. We absolutely are concerned that that's where you have the more likelihood of transmission. And so people need to know the individual risk that they're in the setting that they're in. That is so critical to being safe and being safe to the people around them. So if we can continue to work together, that's the kind of information we want to get out to the public. Be smart, know what's happening, and also know the risk that you have or the people that are in the setting around you have in order to be safe as we get through this respiratory season. We are in a very difficult time right now, but we also know that we've been through a difficult time over the last few years, and we are going to get through this, but we can only get through this successfully if we do it together. And that's where our recommendations fall. Lacey, I don't know if you wanted to add anything on the specifics of recommendations related to what he was referring to on our website or anything of that nature.
Yeah, no, I think you covered it well. The requirements and recommendations for the most part have not changed. I think why you're hearing a lot more messaging from us and you're hearing local health officers and potentially tribal health leaders coming forward is that the risks are changing. And that is a reality that we're seeing in this time of year with rising rates of COVID, as well as other respiratory diseases, and masks work against those too. So that is part of the risk calculation. It is the environment that you're in and the level of disease that is around you in your community.
Okay, our last question is Kate Walters with KUOW. If we did not get to your question today, or if you have a follow-up, please reach out to our media relations team at DOH-PIO@doh.wa.gov. Go ahead, Kate.
Hi, thank you all so much for taking the time. We really appreciate it. I just wanted to check in on racial disparities in vaccine coverage. Can you talk a little bit about what that looks like at the moment, especially for the updated booster uptake, and then also among our youngest Washingtonians, whether we know what coverage looks like by race and ethnicity there?
Michelle, do you want to?
Yeah, great question. We are still seeing significant disparities in differences by race, ethnicity in COVID-19 vaccination rates, including among our booster dose data. So that is, you can, and we can have staff follow up with you. You can look at that on our website. Also, I shared the graph, and we could pull that back up, looking at COVID-19 booster data by age. So we're concerned, and one of the things we're doing is continuing all of our strategies around increasing equity in COVID-19 vaccination uptake, and we're using those strategies to work on flu vaccine and differences in flu vaccine uptake as well. So this includes partnering with community-based organizations to send our caravan out into the communities, into areas, and partnering with local organizations who can help us reach out and share information and invite people in to be vaccinated. It's really on those ground strategies that are needed to help build trust and help partner with community leaders and messengers and organizations to increase vaccination rates. We've also added flu vaccine to our caravan event. So as the caravan's going around the state to communities where we know there's a lot of risk and lower vaccination rates, we're now offering flu vaccination at the same time. But we can make sure you see the data. So if you want some exact numbers for any reporting, we can have staff follow up with you to show you where that information is on our website.
Thank you for that. And Nikki, I'll close and then I'll turn it to you. I just want to, first of all, again, thank our team for being here, everything that they continue to do. This has been a long road over the last few years, and continuing to be here and providing information is so critical. And I just want to say thank you to Nikki and Tao and Michelle and Lacey for that, and all the people behind the scenes that we oftentimes do not recognize. I also want to thank our media partners for the excellent work that they do in covering and providing good information and sensible information that is helpful to our community members so that they can make informed decisions. I want to close by just saying that, we're in a very difficult time right now in respiratory season. We know this is the concern we had when we were asking people to do their part earlier and to take the preventive steps before preparing for this season. This is exactly what we were talking about. We're in a very different place than we were earlier in the pandemic, or earlier when we didn't have the tools, where we had to rely on a lot of requirements. Now we're really asking people to take the tools that we have, that you have at your disposal, and use them effectively in order to be able to protect yourself and protect the loved ones around you, or a neighbor, or a community member, or a coworker, and most importantly, to also help us protect all of us in the state of Washington and our healthcare system, to make sure that this surge that we're seeing, the winter surge, that we get through this and get onto the other side of this in a safe and healthy way as possible. So thank you for everything you're doing. I hope everybody has a happy and healthy and safe holidays. Please make sure that we have an additional amount of information there. Please go to our social media outputs as well, so you can look at what we post, and that information please share with your family and friends. And we look forward to having a happy, healthy, safe holiday season and seeing you on the other side of 22 in 2023. So thank you so much. And Nikki, I'll turn it to you.
Thank you, Dr. Shaw. This concludes today's media availability. I'd like to thank our panelists for their time today, our media partners for their continued coverage of Washington State Public Health, and TVW for hosting today's live stream and archives of past briefings. Thank you all, and please take care.
Record